And I've just seen the marvelous things that happen here. People start moving, and you can't get better if you don't move. So I'm really a big believer in the water therapy.
In the Johnson Aquatic Center, we treat a variety of diagnoses from neuromuscular conditions to strokes to someone that maybe has had a spinal cord injury, people dealing with a lot of chronic pain, and then just general orthopedic conditions. Maybe they are coming up on a surgery or they've just had like a knee replacement or maybe a back surgery.
Well, I hurt my back in January, and if you've ever had sciatic nerve pain down your leg, you know that it's miserable. But I wasn't sleeping at night. That was my biggest concern. You know, my leg hurt so bad. I just couldn't get comfortable.
A lot of times being in the water when we do have back pain or that radiating nerve pain, just taking the pressure off our spine when we can do things with less weight bearing really helps to allow that inflammation to go down and just decompress certain areas, and it helps them feel better.
Well, I do water walking, and then they put weights on my ankles, and they have me use a 5-pound weight to help me build up strength.
She does some jogging with a belt on. She does some exercise holding on to, we call it our Aquarius station, just to get some general mobility through her hips. And then we usually go over to the warm water, which does help with that pain management. And she does some water walking to work her core all directions. She does core strengthening, leg strengthening.
And the warm water is perfect for me. It's the best place to exercise. With arthritis, I think it's one of the best ways to get exercise. It's not so hard on your joints.
I think it's amazing that we've been open for 30 years. I think the patient population that we treat has changed a lot over the years, and now because we have been able to serve so many people in various clinics, people do start to look at us as, okay, this can really be beneficial for patients and can serve a lot of our community that maybe is limited otherwise in exercise.
I see people get in and out of their wheelchairs into the water. I mean, they just are wonderful at, what they do to help patients or people like me.
We can't live our whole life in the water. We do want them to eventually be able to tolerate some activity at home as well. So just progressing her in a kind of graded way that she could tolerate, and eventually those symptoms reduced and she was no longer having that pain in her leg or back.
Yes, it's been a great experience, and I keep coming back. I work here on my own at least once a week. Give it a try. It's worth a try.